So sepsis is a disease that most people have never heard of. A better way to think about it is an overwhelming infection. So what sepsis is when you get an infection and then your body's response to that leads organs to start shutting down. It can be things as severe as you're unable to hold your blood pressure up, unable to breathe, or things that are relatively modest, problems with your kidney, problems with your liver. This entire package is sepsis, and it's an incredibly common disease. It's probably the most common cause of critical illness in the United States, at least on par with heart attacks, maybe even more common among older Americans. So we found that most older Americans with overwhelming infections suffer real brain and body problems for years afterwards. As a result, they place a real burden on their families and loved ones, and may even end up in nursing homes. So we need new treatments, not just for the infections, but in order to prevent this new disability afterwards. We found that a scary number of people had problems with their basic activities of daily living. So if you looked at the large group of people who had no limitations before they had sepsis, fully 40% of them had trouble walking after sepsis. At the same time, if you look at other activities like shopping, preparing a meal, paying your bills, again, substantial numbers of people develop new problems in these who didn't have it before. And indeed, almost 1 in 5 people who had no problems beforehand couldn't toilet themselves, couldn't wash themselves after severe sepsis. And these were problems that persisted for years afterwards. So I think there are 3 things physicians need to do. The first is do whatever we can to prevent patients from developing the infections that can lead to sepsis. Some things as common as flu shots or excellent diabetes care are essential parts of that. The second piece is when patients come into the hospital, physicians need to make sure they get the truly excellent sepsis care that we're capable of, but don't always deliver. And at the same time, we need to prepare patients and families for the possibilities that they're going to face real disability afterwards. And we need to both inform them of this, but also get resources in place to help support them. And the third thing that we need to do is advocate for new treatment and participate in research in order to help us develop new approaches to preventing this disability.